Well, for more, we're now joined by Firass Abiad in Beirut. He's the Lebanese health minister. So, Minister, thank you for joining us on TRT World. Now, over 600 people have now been killed. Israel says it's targeting Hezbollah. But how many, let our viewers know, how many Hezbollah were actually killed in those attacks?
Well, if you look at the indiscriminate attacks that have been occurring in the past, this week alone, the number actually is higher. It's around 750. This includes around 160 women and children. It includes 2 UN staff, one of whom was killed with her 3-year-old son. It includes 9 healthcare workers and ambulance workers in an attack on 18 ambulance cars and on firefighting engines. Clearly, the vast majority, if not all of the people who got killed or injured in those attacks were civilians, despite the blatant lies that Israel is claiming.
But, Minister, where is Lebanon as a state in all of this? Are you ready to confront Israel? You know, we only hear from Hezbollah when it comes to confrontation and preparedness should this war escalate.
Not at all. And I think your report showed that our Prime Minister and our Minister of Foreign Affairs are actively engaged in the high-level discussions at the United Nations General Assembly and at the Security Council meetings. And the message from the Lebanese government is very clear. Lebanon, from the beginning, Lebanon has said we do not want war, and we have been calling for a ceasefire, and we have been calling for a diplomatic solution to as a resolution for this conflict. Also, concerning the proposal put forth by the US, the G7, and other countries such as Saudi Arabia, UAE, and Qatar, Lebanon has accepted that proposal. There's only one country, actually, that has refused to accept that proposal and is still killing innocent civilians, women and children with its indiscriminate attacks, and that is Israel.
So you're calling for a ceasefire, but Hezbollah has yet to respond to the truce proposal. We're not hearing much from Israel either. Does Hezbollah decide on the truce, or does the state of Lebanon?
I think that Hezbollah has also made its position clear from the beginning. And that is when we have a ceasefire, then it is very clear that the hostilities will stop. But the problem is that the one who is actively engaging in attacks on Lebanon is Israel. I mean, if you look at the level of attacks at the regions that are being attacked, it is coming mainly from one direction, and that is Israel. And if you consider that when the communication device explosions occurred last week, this coincided with the visit of the United States Secretary of State to the region. He was trying to push for a diplomatic solution. And I think that, these attacks, indiscriminate attacks that occurred were a slap in the face for the efforts, to go for a diplomatic solution for this conflict.
So how are you as a ministry or as a government trying to better help the people of Lebanon, given that the spectre of war is being raised?
Well, there are two issues. The diplomatic efforts that we have been discussing, but also we have been in the health sector preparing our health sector for any consequence or any eventuality. So we have been, since last Tuesday, we have been actively working to receive all of the injured in our hospitals. Up till now, the tally has exceeded almost 6,000 injured. We have been also working hard to expand our capacity. Friends and nearby countries have been supporting us. We've received help from countries such as Iraq, Jordan, Egypt, and yesterday Lebanon also received medications and medical supplies from Turkey. Almost 30 tons of much needed medications. So what we have been trying to do in the health sector, at least, is to increase our readiness for any eventuality should the escalation continue.
And so that regional support that you talk about is very important. But how much longer can your health system hold till, unfortunately, the dam breaks, so to speak? What more would you need as a ministry? You talk about being prepared, but what more needs to be done?
Well, I think we are working to get more supplies and medications and ready our staff. But I think what we need is this ceasefire to go through. And I think that that is why, at the end of the day, the answer is not more preparedness as much as the answer is in exerting the right amount of pressure, especially from Israel allies who are calling for a diplomatic solution, to exert the pressure on Israel to scale down and go along the diplomatic solution route.
Do you, though, have confidence that world leaders, I mean, they're gathered in New York at the moment at the UNGA. Do you have confidence that they can help bring things back from the brink of war?
Well, I must be honest with you and confess that this is a story that we've heard before repeatedly in Gaza, where the international community comes and proposes a ceasefire and even comes up with UN resolutions, and then does not exert the needed pressure for Israel to scale down or stop its atrocities. And that's why, as much as I am hopeful that we will go to, in that direction, and how, as much as I dread if we don't, the consequences and, the escalation that might happen, let's say I'm not optimistic.
So you're not optimistic. But Minister, just lastly then, before we let you go, what would be your message from the people of Lebanon to the rest of the world?
I think that the message that is coming from the people of Lebanon, but also from the people of the world, as we have been seeing along the demonstrations in the street, as we've been hearing from the United Nations General Assembly, speech after speech after speech from world leaders, ceasefire now. We need a ceasefire now from Gaza to Lebanon. That is the right step to do now, and then we move in the direction of a diplomatic solution.
OK, well, we hope that ceasefire does come. Firass Abiad in Beirut, Lebanese Health Minister, thank you for joining us on TRT World.